Benzodiazepines, the popular medications for anxiety. So in this group, we have Xanax, Klonopin, Valium, Ativan, Librium, Serix, and some other meds. I personally have rarely used the bottom half of this list. And also I avoid Xanax, which we'll get to later. But yeah, these are medications that are frequently prescribed, especially by non-psychiatrists. So how benzos work is basically with helping the so GABA system or GABAergic neurons are basically inhibitory neurons. They inhibit signal transduction. Whenever you hear GABA, it means inhibition. It means it's slowing down. So what benzos do is that they enhance the inhibition of GABA receptors. So they GABA receptors work with chlorine channels, and when benzo is added to the mix, they help enhance the influx of chlorine, and basically they have an exponential effect on the inhibition with GABA. That's how they work. And for the same reason that because of their mechanism of action, they are approved to help with generalized anxiety, panic disorder, acute alcohol withdrawal that we briefly discussed before, seizure disorders, insomnia, and they are sometimes used for pre-medication for anesthesia to help with anxiety before surgery, or even help with muscle spasm relief. Off-label use, they are used in psychotic catatonia, patients who suddenly stop talking, moving, interacting. We don't know how this medication is helping catatonia exactly, but they work. In mania and agitation, especially in bipolar disorder, these medications can be helpful. In muscle rigidity and tetanus, again, muscle rigidity or spasm is when there is an increase in neuronal firing, and these medications can block that, right? And for night terrors, they can be used. When it comes to considerations, there are a lot of considerations with benzos. So they are very popular, favorable by patients because they work very quickly. It's a matter of immediately 2 hours. They decrease physiological hyperarousal. They help with agitation, anxiety, insomnia, elevated mood, and they are favorable for their side effect, which is sedation, basically, right? But also they can cause memory impairment. They increase risk of falls in older adults. With continued use of benzos, usually a tolerance develops. So the same dose may not be as impactful anymore, and there is a need for dose increase over time. People may experience withdrawal symptoms if they are long enough on one of the benzos, and we suddenly discontinue that. And of course, there's a risk of addiction. So, and usually the risk of addiction, I didn't put this slide here, but so benzos have different half-lives. There are those that are very short acting, they're quick, and they disappear from the basically our body very quickly. And those have more risk of addiction, like Xanax. So I personally, whenever I see someone on Xanax, there is an alarm sign that goes on in my mind. But there are those like Klonopin that are more long acting. They start to show their impact slower, and they stay in the body for a longer period of time. They have less risk of addiction. And caution. So we would want to be cautious about prescribing these medications in older adults because of the sedation, memory impairment, and falls. In people with dementia, we would want to be cautious about prescribing them to not further impact their cognition. I see Catherine has raised her hand. Catherine, is it okay if we wait for a few more slides because we are almost kind of done with the presentation, and then
Yes, yes, yes.
I appreciate it. Thank you. So in dementia, in patients with substance use disorder have a higher risk of developing addiction to these medications. In those who are frequently drinking, and also in pregnancy and lactation, because those medications can get secreted in the breast milk and impact the newborns.